Hi, this is Dr. Mark Lewis for Medscape Oncology. In this month, I wanted to address maintenance of certification. I am far from the only doctor, certainly far from the only oncologist, to recently comment on the topic of MOC. And of course, this is happening in a wider debate about our relationship as subspecialists to the ABIM, the American Board of Internal Medicine, and what they deem acceptable for the recertification of doctors in practice. And I guess my take on this is that every oncologist is already engaged in lifelong learning. One of the things I tell my patients is if I practiced exactly the way I was trained to practice, and I had a very good fellowship program with superb faculty, but if I practiced the way they taught me, it would now be malpractice. I finished my fellowship in 2012, just over a decade ago, and the rate of progress in the interim is simply staggering. It looks so different now than it did then. For instance, 2011 was my first experience ever using a form of immunotherapy. It was an anti-CTLA-4 agent, ipilimumab, and I was treating metastatic melanoma. And I learned in that instance just how effective these drugs can be, but just how toxic they can be also. And ever since then, I've been refining my use of immunotherapy, and we do that iteratively. We do that as we encounter patients and as we try to meet their needs. And I do understand that what the ABIM is saying is that they want an independent governing body to legislate that process. But I think the reason this is stuck in the craw of so many oncologists is we demonstrate our commitment to continuing medical education all the time. And it's funny, I'm recording this in my office. This is separate from the space where I see patients. I see patients in a different group of exam rooms for their privacy, and it's better set up for aspects of the physical encounter. Not a single patient has ever asked to come into my office and see my diplomas. And I sometimes wonder if I keep them here mostly as a visual cue to myself, sort of an antidote to ward off imposter syndrome and remind myself, oh yeah, I earned these. I earned these through formal training. But something happens once you finish your training, whether it's residency or fellowship, and you become an attending. And I think you feel a weight of responsibility, and that is independent learning. All of us are doing this. We have to do this. The field is moving along at such a rapid clip. It's essentially built into what we do that we are going to keep up. In fact, channels like Medscape, not to mention all the various aspects of social media, are a way I curate my own information feed so I can stay up to speed and not feel like I'm drowning in a deluge of new data. And I think what's hard to demonstrate to the ABIM is that is already happening. I think we can do it if we submit our records of CME and the credit that we formally accrue. But the reason this is such a almost insult to oncologists in practice is this is a necessary part of our day-to-day existence, is keeping apprised of the latest developments so we can apply them to patient care. One litmus test of attending a medical conference, like say the ASCO annual meeting, is to ask oneself, when you go back to clinic, is this meeting going to change the way that you take care of patients? And the answer almost invariably these days is yes. I go to multiple meetings per year, and I think it's the exception, not the rule, that I return home and nothing changes in my management patterns. So again, this process is happening whether the ABIM recognizes it or not. And then lastly, I'll say, I sat down last fall and I did my recertification. I sort of looked at the span that all the things that had happened between 2012 when I first sat my board examination in medical oncology and 2022. And it was staggering, but I think the reason that wasn't such an overwhelming amount of information to review is I had actually been accreting it slowly and gradually, month by month, year by year, throughout that decade. So again, it's necessary that the ABIM hear us, hear oncologists, and know that of all the medical subspecialties they govern, it is basically an essential task of our day-to-day professional existence that we already engage in lifelong learning. And to suggest otherwise really paints us as outdated. And the reason that matters so much is if we're not up to date, then we are underserving our patients. So with that, I'm off to do more lifelong learning. It's Mark Lewis from Medscape Oncology. Thank you.